President, I do not know, and I don't know if anybody knows, whether the Republican so-called health care legislation will pass tomorrow, whether the beginning of the debate will take place or whether it will not. I don't know that. But this I do know, is that the legislation being proposed, and by the way, we still don't know what that legislation is, but in general, what we do know is that that legislation being proposed is the cruelest, most destructive, and irresponsible piece of legislation ever brought to the United States Senate in the modern history of our country. Now, I know the media focuses on, do the Republicans have the vote? How is this senator going to vote? How is that senator going to vote? And all of that is interesting to those of us inside the Beltway. But the far more important issue, which we don't discuss enough, media doesn't cover enough, is what this legislation actually would do if it were implemented. Right now, unique among major countries on earth, we do not guarantee health care to all people as a right. And the result of that is that we now have today, before this disastrous legislation, we now have 28 million Americans who have no health insurance, and even more who have high deductibles and high co-payments, preventing them from getting to a doctor when they should. So we've got a bad situation now. It's better today than before the Affordable Care Act was passed, when we had over 50 million people without insurance, but no one suggests that what we have today is where we should be. And yet, with 28 million people uninsured, the Republican solution to this problem is to throw another 22 million people off of the health insurance that they currently have. And I want the American people to, for one moment, put themselves in the place of somebody tonight who may be watching what we're talking about here, who has cancer, who has a heart disease, who has diabetes, or some other life-threatening illness. Millions of people are in that position. They are struggling for their lives right now. They're under treatment. And they are thinking, what happens if this Republican bill is passed? Will I live and continue to get the treatment that I need, or will I die? And I think there are very few members of the Senate who have met with their constituents on this issue, who have not seen people break into tears, asking what is going to happen to me or my children or my parents. We did a teleconference town hall a few weeks ago in Vermont. We had some 16,000 people on the line, and a woman calls up whose kid has a very, very serious illness, cost of the prescription drugs off the chart, and she asks, what is going to happen to my child if this bill goes through? And you know what? I didn't have the guts to tell her what might happen to her child. I don't want to be on the phone telling any person in Vermont or in America that their child might die because of the legislation that might proceed tomorrow. This legislation would cut Medicaid by almost $800 billion over a 10-year period, taking health care away from lower-income and working-class families, including many children with special needs, kids with Down syndrome, kids who have serious emotional problems, kids whose lives now depend on Medicaid. When you cut Medicaid by $800 billion, many of those children will lose coverage entirely or receive significantly fewer benefits. This legislation, when we cut Medicaid by $800 billion, will have a severe and dramatic impact on nursing homes all over America. A lot of people don't know this, but if your mom has Alzheimer's and is a nurse in a nursing home, or your dad has a terminal illness and is a nursing home, guess what? Medicaid pays almost 2/3 of the costs associated with nursing home care in America. What happens to the people in nursing homes when you slash Medicaid? How many of them are going to get thrown out of the nursing homes? Where do they go? Are families in America, working class families, going to be forced to make the choice of whether they take care of their parents or whether they send their kids to college? Those are the choices that working class families may have to make if this horrific legislation gets passed. This legislation would dramatically decrease funding for the opioid and heroin epidemic that is sweeping this country, including my state of Vermont, including Kentucky, West Virginia, New Hampshire, states all over this country, Ohio, struggling with the opioid addiction problem. And the program that provides the most funding to help deal with addiction treatment and addiction prevention happens to be Medicaid. So what happens to our efforts to try to get a handle on this terrible, terrible epidemic sweeping our country when you make massive cuts to Medicaid? You know, I found it amusing that when Donald Trump ran for president, he was a great friend of the working class. He was going to stand up for the working class. Well, let me mention to workers all over this country who are in their 60s that if this legislation passes, your premiums are going to go up dramatically. That's one of the reasons why the AARP strongly opposes this legislation. If you live in Baltimore, for example, where I was this morning speaking to the NAACP, in Baltimore, if you are 60 years of age and you make $40,000 a year, your average health insurance premiums will go up from about $4,000 a year now to $8,800 per year, more than double. So if you're a 62-year-old worker making $40,000 a year, not a lot of money, how are you going to pay that? And remember all that Donald Trump said about what a great friend of the working class he was. This legislation would defund Planned Parenthood. You know, I get a kick out of hearing my Republican friends talk about choice, freedom. Oh, my goodness, they just love choice and freedom. They want the American people to go to any place they want to go. It's all about what America's about. Well, 2.5 million women have made a choice. And the choice they made is they want to get their health care from Planned Parenthood. But that choice, that freedom, would be taken away from them starting tomorrow in the process if this legislation is passed. When you think about insurance, you think that insurance is about covering you in your time of need. But before the Affordable Care Act was passed, many millions of the American people could not get the health insurance that they needed to address their particular health care crisis. If you had a heart disease, if you had breast cancer, if you had diabetes, the insurance companies would say, hey, we are in the business of making money. Why in God's earth would we want to insure you if you had breast cancer 5 years ago and it is possible it might recur? That's a losing proposition for us, because that's what insurance companies want to do. They're not in the business of providing health care. They're in the business of making money. So they denied, unbelievable, when you think about it, how crazy this is, they actually would deny coverage to people who had pre-existing conditions. Well, I've got problems with the Affordable Care Act. It's far, far from perfect, but it did end that obscenity of allowing insurance companies not to cover people who had pre-existing conditions, something that is just quite unbelievable. Well, guess what? If this legislation is passed, in all likelihood, many, many people in this country with pre-existing conditions will not be able to get health care that they need at a price that they can afford. Now, we don't quite know, Mr. President, how many of them will die. Nobody can make that prediction. But I want to read for you a very interesting article that appeared in from an institution called PolitiFact. And PolitiFact is an entity that tries to keep a check on what politicians say. And they look at you, you make a statement, and they say, is this true, or is this guy not telling the truth? And so I was on a TV program called Meet the Press a number of weeks ago. And I said, well, you know, if this Republican legislation is passed, thousands of Americans will die. Oh, and my Republican colleagues and the right-wing media, oh, Bernie Sanders is engaging in hyperbole. He's exaggerating. Who wants to see anybody die? I know that nobody here wants to see anybody die. Of course not. No Republican does, no Democrat does, no independent. But we have to look at the consequences of what we do. So, what PolitiFact did was take a look at the studies to see whether or not I was telling the truth. And let me quote, and by the way, I would like unanimous consent to introduce this article into the record.
Without objection.
Thank you. One of the studies that we cited, my office cited, was published on June 22, 2017 by the Center for American Progress. It was co-authored by a Harvard professor of social epidemiology, 2 medical students who graduated from Harvard's Chan School of Public Health, and 2 policy specialists at the Center for American Progress. I won't go through all of the details, but I will say, quoting from PolitiFact, the Harvard Center for American Progress study projected that there would be 1 excess death for every 830 people who lose coverage as a result of the AHCA, the Republican bill. Using CBO's projections of the impact of the House version of the bill, the authors estimated an additional 217,000 deaths over the next decade, or 21,700 per year. It's not Bernie Sanders. That's a study done at Harvard. Second piece of evidence Sanders' office cited was an op-ed by yet more health policy specialists who are affiliated with Harvard, David Himmelstein and Steffi Woolhandler, who are professors of public health at Hunter College, City University of New York, as well as lecturers at Harvard Medical School. Adapting the findings of a 2012 study to a scenario in which 20 million Americans lost coverage, which turned out to be lower than what the CBO found for the House bill. They estimated 23 million would lose coverage. Himmelstein and Woolhandler estimated that there would be 43,956 deaths annually due to the GOP's health policy changes. So, can Sanders' assertion, I'm quoting again from PolitiFact, be supported by the peer-reviewed literature alone? And then they cite some studies. 2002, a panel of more than a dozen medical specialists convened by the federally chartered Institute of Medicine estimated that 18,000 Americans had died in the year 2000 because they were uninsured. In January 2008, Stan Dawn, a senior research associate at the Urban Institute, published a paper that sought to update the IOM study with newer data, replicating the study's methodology. Dawn concluded that the figure should be increased to 22,000. A 2009 American Journal of Public Health study concluded that a lack of health insurance, quote, is associated with as many as 44,000 deaths in the United States, more than those caused by kidney disease, end of quote. And on and on and on it goes. It's not Bernie Sanders talking. This is scientific and medical study after medical study saying what is obvious, that if you have a life-threatening disease and you cannot get health care, you will die. So I would hope that my Republican colleagues, as they vote tomorrow, understand the consequences of their vote. I know no Republican, nobody here wants to see anybody die. But when you take 23 million people off of the health insurance they have, many, many thousands of those people will die. You know, Mr. President, I think most Americans would think that when you are dealing with an issue like health care, which impacts, by definition, every single person in our country, and when you deal with an issue that impacts about 1/6 of the American economy, over $3 trillion a year, that you just might want to have some serious discussion on that issue. You might want to ask, here's a radical idea, ask doctors what they think about this legislation. What is it going to mean to their patients? Wow, that's a pretty radical idea. Dealing with health care for all the American people, you might want to have one hearing maybe and say to doctors, what do you think about this bill? What about hospitals? How will this bill impact hospitals, especially rural hospitals in Vermont, Virginia, all across this country? You might want a hospital administrator. You might want to talk to a patient advocate, maybe somebody from the American Cancer Society, somebody who is active in the diabetes effort. You just might want to talk to the experts on health care as to how this legislation might impact the work that they do. But amazingly, in an unprecedented way, this legislation was written behind closed doors. I think it was 12, 13 Republican senators wrote this bill. Most Republican senators don't even know what is in this bill, let alone Democrats, let alone the American people. How do you write legislation that impacts every American, 1/6 of the economy, and not have one public hearing to hear from those most knowledgeable about health care in America? But that is exactly what the Republican leadership has done. And I know why they did that. It's not a secret. If you had a horrific piece of legislation, trust me, you would want as little public discussion as possible. You would try to hide what this bill does. I understand that. But yet, despite all of that, it turns out that virtually every major healthcare organization in America opposes this bill. Now, I don't know how you can go forward with legislation that has had 0 public hearings, that is opposed overwhelmingly by the American people. Last poll that I saw from USA Today had 12% support for this legislation, and go forward with legislation opposed by every major healthcare organization in America. This bill is opposed by the AARP, the largest senior group in America, opposed by the American Hospital Association, the American Medical Association, the American Cancer Society, the American Heart Association, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Psychiatric Association, Federation of American Hospitals, the Catholic Health Association, the American Lung Association, the Cystic Fibrosis Foundation, the March of Dimes, the National MS Society, and the American Nurses Association. In other words, virtually every major healthcare organization does not want to see this bill passed. The American people overwhelmingly do not want to see this bill passed. So how come it might pass? People don't want it. Healthcare organizations don't want it. Who wants it? I'll tell you who wants it. People who are going to get tax breaks, they think it's a great idea. Billionaires who got $200 billion in tax breaks from the House bill, hey, they think it's an extraordinary idea. So what if 23 million people lose their health insurance from the House bill? Top 1% get $200 billion in tax breaks. Large healthcare corporations like it, the insurance companies, the drug companies, they're going to get combined hundreds of billions of dollars. I'll tell you who else likes it. Those people associated with the Koch brothers who are spending hundreds and hundreds of millions of dollars on elections, they like it because their ideology, their philosophy is that government should play no role in the concerns of the American people. And mark my words, if this bill, which would cut Medicaid by $800 billion passes, Medicare will be next, and already in the House they have passed legislation that would voucherize Medicare, and Social Security will not be far behind. That is the ideology of the Koch brothers and the people who fund the Republican Party. And their concern is with large campaign contributors, not the American people. So I would hope very much that tomorrow, when we assemble here, I gather in the afternoon for a vote, the Republicans will think more about people in their own state, about the children, the elderly, the sick, and not just about their campaign contributors. Thank you very much, Mr. President. Yield the floor.